Let's catch up on violence against healthcare workers news. 2 nights ago, Multicare Allen Moore Hospital in Tacoma, Washington, in the emergency department, a man walked in and shot a man and a woman in the lobby. Shot a man dead, and the woman is expected to make it. Police are still looking for him. They think that it may have been a targeted attack. Maybe there was some sort of altercation between them prior to the two going to the hospital, and he came in and targeted them. It doesn't matter. Does it matter, really? The fact is, he was able to freely walk into a hospital with a loaded gun and kill someone and almost kill someone else. That's the bottom line. Why? Because there's no security in hospitals. And when they say there is, it's a joke. It's not real security. July 24th, Rochester, New York, Highland Hospital. A nurse in her 60s had finished working her shift and was walking out of the ER into the parking lot to go home. A man approached her and repeatedly asked her, "Do you work here? Do you work here?" And she thought he needed help. He assaulted her, punched her. She suffered a concussion, facial fracture, dental wiring, all manner of things. They do have a GoFundMe set up for her. He took off, and a couple of days later, he was at the gym and threw a dumbbell and assaulted staff at the gym. And then they finally arrested him outside a church a couple days later. He's now in custody, charged with 2 counts of assault. He refused to go to court for his arraignment, but he is in custody. He'd been seen earlier that day in the ED and left AMA. Targeted someone that worked there. He made sure that she worked there. And here's the part that just makes it a million times worse. I'm told she was just a couple of weeks away from finally retiring. August 3rd, Oklahoma City, Oklahoma, in an emergency department. A patient is on a hallway bed. The nurse goes to just check his vital signs. He grabs her and assaults her for doing her job, for just checking his vital signs. What did you think was going to happen when you came to the ER, dude? Luckily, he has been charged with assault and battery of an emergency medical care provider because Oklahoma is one of the few states that actually makes it a felony to assault a healthcare worker. June 20th, Pembroke Regional Hospital, Ontario, Canada. A nurse, just standing at the nurses' station, violently assaulted, suffered loss of consciousness. She did press charges, and the hospital appears to be supporting her because not the United States. Let's end on some good news. Nurse Leela is home. She's finally been discharged 5 months after the brutal attack at HCA Palms West, Florida Hospital by her patient, in which almost all of her facial bones were fractured. She almost lost an eye. Remember that horrific attack? I have the full update on this week's episode of Nurses Uncorked, but this is good because Nurse Leela was one of the worst cases that I have ever seen. Her daughter came on episode 93 of the podcast and told the entire story, but she's home now. She has a long road of recovery still ahead, but she's home.